and welcome to an all-new episode of Hatching for Health, where our mission is to create a platform for individuals to tell their story, to educate the public, and to build overall a more compassionate community. On today's episode, we're going to be welcoming Ms. Kathy Tatum. She's going to share her inspiring story of how she has overcome the impossible. Kathy has faced extraordinary circumstances throughout her life, from her mom giving birth to her at just 12 years old to homelessness and a medical scare. Although her life has not been easy, Kathy has prevailed time and time again, and she is now the proud founder of Collaborating Voices, a fellow nonprofit Houston foundation that is dedicating to provided resources of all kinds to the community. So let's welcome Kathy.
Thank you.
Yes, it's such a pleasure to meet you. I know we've been in conversation for a few weeks now, and I just love all the things that you're doing. But let's start with kind of understanding your story. So just knowing that your mother gave birth to you at 12 years old I'm sure was a rocky start from then. So tell us a little bit about that and your relationship with your mom.
Well, my mom comes from trauma, but I didn't know her until my grandparents raised me. I knew them as mom and dad until she turned 18, and then she had a medical scare. And when she tried to get custody of me, unfortunately, she dealt with mental health. And that's one reason why we do outreach, because the mental health, I can not even imagine having a baby so young and then coming back into the life and that stress that she had on her life. But mental health that she dealt with, skits and looking at things and looking at the wall and asking me, did I make it to school? And she had a lot to do with, I became a caregiver almost.
Wow.
Like I just learned who she was, and then I felt like in public it was perfect, but when those doors closed, it was tragedy. It was a lot of trauma. It was a lot that she dealt with. And I don't know if because I remind her of her trauma, but unfortunately with mental health, she did have a drinking problem, which actually advanced it. Okay,
so did y'all live with your grandparents, her parents at the time?
She's never lived with me. I knew my grandparents as my parents. So when they introduced my mother, she was introduced as the babysitter. So that's how gradually family secrets come out. And when you go to doctors and they start asking questions what your family history was, it's little questions in ways that would be on people's face, be like, ooh, she's gonna find out why you asked that question, doctor. And I'm like, well, you guys are here, answer the question. But it's little things like that that I had clues that my parents weren't my parents.
Okay. And so what about dad? Was dad in the picture, this individual that your mom, conceived you with, or was he not somebody that was around?
My dad is, technically my grandfather is an Army veteran.
Okay.
But my biological father actually died in prison.
Okay.
Yep.
Did you ever get to meet him?
Oh yeah.
Okay. Yeah. So you were told who he was, and
absolutely.
It was a relationship.
He went to prison at 17, and he died. Both my parents are deceased now, but both of them died of cancer.
Okay. And the grandparents passed on?
Three sets died of cancer.
Okay.
Cancer is cancer.
Yeah. Do you have children of your own?
Yes, 5 girls.
5 girls. Wow.
Yeah, poor thing. That's why I'm always in the community.
I know. Yeah. Exactly. So so basically, you grew up in a very not typical household, with grandparents being mom and dad and things of that nature. So as you progressed in life, I'm sure that just kind of it changes things. Did you go into any kind of foster care system at all, or were you with them?
When she was struggling, my mom was in and out of prison. And like I said, with mental health, she's done some things with me. And like me and you discussed before, 14 years in the basement. I was allowed to go to church, and I was allowed to go to school. Okay. The school looked at it as never missing a day of school, but at the end of the day, I had bullet wounds all over my body. I have cigarettes wounds, 45 broken bones. Back then, I think mothers had a lot of chances. Like if I came to school with a broken arm, we would blame it on sports. So I was very heavily on sports because I know it went hand to hand. Not only did I enjoy sports, but it was also a cover up on what health problems I was going through. And when I had so many broken bones, I don't know if you know this term where they say you have a growth spurt or you have growing pains.
Yeah.
And that allowed her to cover up on, oh, why is her finger broke? Why is her nose broke?
So she was very very abusive.
Very abusive.
And this was just her. It wasn't the
No.
father. It was just her. And
absolutely.
And were your grandparents like, you know, aware of what was going on, or was this like?
They tried. They tried, but at the end of the day, they didn't have real foster care and adoption. So because of, as you know, a lot of grandparents, even as today, are raising their kids. When I would go to the hospital and they ask you who to call, my mother was not with me all the time. I grew up in a time where the Boys and Girls Club, there was a clinic upstairs. You did not need a parent to go into the clinic. Okay. So I was able to go in there, get my wounds taken care of, and they didn't ask a lot of questions. When CPS would come to the school and go, what happened? I was also a protector. You know, the threats were there of, okay, my skin is falling off. Oh, I think that's poison ivy. I came up with everything that I can think of. Been through it all. Yeah, to think of my health. But teachers knew, and they tried. I would come in. I should be 110 pounds, but I'm sitting at 90 pounds. So I had, if I can say, one of my teachers, Senator Pugh, I used to steal her lunches. And it got to a point where she took me home one day, and right away she knew. Because my mom came outside with a knife and, how dare you? And she knew to bring 2 lunches. Wow. And that's where I say, you see me feeding the community because I know what it feels like to starve. I know what it feels like to be in that basement, and if I didn't have any on the weekends, we had water that trickled down when it rained that I would sit there and lick off the wall just to get water.
So you were put in a basement.
Absolutely.
When you were
with
home.
A bed and everything, with a shackle and everything.
So when did you have the ability to escape this environment? I mean, not that going out on your own is, you know, a safer environment, but
absolutely.
I'm sure that the ability to do that probably would give you more confidence in, you know, not being abused.
I would say that I'm not a one-time escaper. I tried to escape many, many times. Walked around. I remember being gone for like 2 weeks, and I literally lived in a doghouse, and the parents thought their daughter was lying and had an imaginary friend, but I literally was living in her doghouse. And she would come out and say, I'm going 2 sandwiches, and I would be in that doghouse. And I escaped there, and I go into foster care, and she didn't like the foster parents, and once again I was back in her household. I would escape. I knew where the prison was. I would go to the prison and say, hey, I got a lot of family members in here. Can you let me in? And they were like, little girl, get away. So I escaped so many times, but the kicker was at 2 o'clock in the morning. Yeah. My mom came home with her boyfriend. They let me out. I thought I was gonna eat. They had steak and shrimp, and she made me cook it. And I'm looking at her boyfriend. I'm like, do you see all the bandages on me? Do you see what I look like? And you can see the expression on his face, like, did she just come out the basement? And she's like, he said, I don't want nothing to do with that. So he left, and she blamed me for him leaving out the door. So she took a knife and she put it to my neck. And I just asked God. I know I was raised with honor thy mother, thy father. I did not put my hands on her, but I was begging. Yeah. And I said, please, Lord, let me survive. And she took me in the backyard and she tried to bury me. And right before the dirt came all the way to my neck, she fell asleep drunk.
Oh my God! So she had buried you.
I'm in the dirt.
Alive.
I'm in the dirt. Yes.
Oh my God! And the boyfriend had left at this point.
He had left.
Goodness, like this is, you have been through everything imaginable. So she fell asleep, you got yourself out of the dirt, and that's the last time that you saw your mom, or what did you?
I walked until I could find a nice family that I thought was a nice family, but she was not home. The woman that I knew that took me skating and stuff like that, but her husband was there, and tragedy happens again. She said, she's in the basement, and I was there for 2 months, listening to my friends play outside. I was wondering why nobody came to look for me, because you have to go to school, and he repeatedly raped me. And then I was pregnant in that basement, and finally, she came down there and called the cops on her own husband.
And this was just a neighbor that you felt that you would be safe with?
I thought I'd be safe with.
And how old were you at that point?
I'm 14.
At 14?
Yeah.
Okay, so now you're pregnant at 14, and did you leave that household to get, once she told?
No, I'm actually homeless.
At that point?
Because I have enough credits. I've always been a smart person in school. I've always had, but they would not let me graduate early. So I'm homeless. I picked a college. And I ate out the trash. I had a good friend that would let me come in and take a shower and go to school. People really thought I was a college kid. I mean, I blended in. I mean, I would go in there and play pool. But anytime that I realized that I wasn't healthy and I was getting sick, I needed Social Security, I needed a birth certificate. She had to sign off. So I had to take the courage to knock on her door.
Your original mom?
Oh, she saw me every day.
Okay.
It's not like I'm going out the neighborhood.
Yeah.
I got a job at the mall. I walk past her house every single day, and my sisters and them were like, "That's my sister," and I had to get on the bus, but I had to get that.
So you had siblings?
Absolutely.
And were they not going through the same?
No.
Like she had them later in life, and
they look different. We totally look different. We have two different fathers. But at the same time, like I said, she treated them wonderful. It's almost like Cinderella. I'm in the basement, I'm cleaning, I'm scrubbing, they got the food. My mother passed away from cancer a couple years ago, and I realized, even though all these years I was like, how could you not participate on saving me? At her funeral, my sister said something that I realized she was not realizing. And at the funeral, she goes, "You were the favorite." And I said, "I'm the favorite?" And she said, "Yeah, because you were always at the hospital." And I'm like, "Oh, okay." And she's like, "Yeah, you had a special room. It had all the locks on it and everything." But in her mind, me going to the hospital over there, I must have been nurtured in this health.
Right, just a mental health, problem that was like escalated to your childhood, entire childhood.
It's
and
amazing.
then that your siblings even looked at it like that, like, like as though you were favored, and it's like.
I was favored going to the hospital as much. They didn't go to the hospital. Well, you didn't have any injuries, but it amazed me at the funeral, like, really? That's what you saw, me going to the hospital over and over.
Goodness. So once you became homeless, but yet kind of like, I guess, gravitating towards, okay, this university has a student that knows you, is giving you food, letting you shower, but where did you actually sleep at that point? Were you still going to the neighbor, not the neighbor that got you pregnant?
No, I'm outside.
Okay.
I'm outside, I'm begging the school to release me. They said they can't, opportunity. Job Corps is usually for troubled teens. I wasn't a troubled teen, but I had no roof over my head.
Okay.
I could not go to college. I had scholarships. I could not enter college until my graduating class graduated, and then I said, well, how old do I need to be in a nursing program? And they said 17. So I joined the nursing program, and that teacher is from Houston, Texas.
So you were homeless while getting your education. So at the time, and I know we're going to get to it about resources, but what resources were there for you? Like, there wasn't a place that they could take you in, and care for you in a safe environment while going through school. Was there not something for you?
That's why I'm such an advocate, because I talk about the things that people run into that people don't talk about. Yeah. Me wanting that driver's license, me wanting to have a Social Security, me wanting to have a birth certificate, those barriers are here today.
Right.
You have to have an adult to do things as a kid. So when we are talking about aged out foster care, when we're talking about human trafficking, those things, I could easily been human trafficked.
Of course, yeah.
Absolutely. And that's where those barriers come in, where I'm fighting and say, hey, these kids should be able to go in at 14 or 15 and get their own resources. And still, we have those barriers.
Yes. We're gonna have to take a commercial break, but I'm really excited to talk about your foundation, because I see why you're so passionate and why it's collaborating voices, which we're going to be coming back after the commercial break to talk about. So
absolutely,
we will be right back with you, and we're going to learn all about Collaborating Voices, the nonprofit that Miss Kathy started. We'll see you soon.
I was recently involved in an 18-wheeler accident. The insurance company was only offering me $1,000. I called Tom Thurlow, and he was able to win me a settlement of $245,000.
Don't delay. Call Tom today. 713-CALL-TOM.
Your private practice deserves more than sticky notes and missed calls. Funnel Cake MD is the HIPAA-compliant growth platform built for doctors and dentists. Manage calls, texts, and emails in one secure inbox. Book more patients, cut the admin chaos, and keep your front desk sane. Try it free for 14 days with full white glove onboarding so you're running smooth from day one. Don't let outdated software hold you back. Sweeten your growth with Funnelcake MD. Start your free trial now at funnelcakemd.ai.
Funnelcake MD, all-in-one tool to grow your practice.
In 2020, I was going to work and the stairs of my apartment broke, and I went 20 feet through, breaking my back in 2 places and 5 discs herniated. I was scared, alone. After meeting Dr. Remy Nader and his staff, it got me back to not only the dad I used to be, but the person I used to be too.
At the International Center for Neuroscience, we take pride in providing you second opinions for your brain or spine problems. I'm Dr. Remy Nader, board-certified neurosurgeon. Let me help you get your life back.
Welcome back to the program. If you have just joined us, we are accompanied by Ms. Kathy Tatum, who is the founder of Collaborating Voices, and we are learning about her journey and her story and why she's still alive, thriving, and helping the world. So Kathy, before we went to commercial break, we were just getting into your foundation. But before we do, I know that there was another trauma that you experienced, not just all of what we have already discussed, but there was something else when you went to do a stress test?
Absolutely, and that's why I love your title, Hatching for Health, because I really believe in 2017, because I worked so hard, my job had an email that went out and said, hey, part of your insurance is stress tests. And I went to go, because I do real estate and we had so many homes, and this is where you had the lockbox where I unlocked, I really wasn't paying attention to the stress test. And the doctor said, you're gonna have to come back. You can't be on your phone, you can't do anything. And I'm like, yeah, I'll be back. And that morning, I could no longer walk. Paralyzed, we're looking at health, and I'm like, yeah, I got health insurance, but I can't walk. Maybe I just, the Lord set me down, I need a rest.
Right.
But I no longer could walk. My husband had to go to work. We have a bunch of kids, and he literally had to put a diaper on me. He had to go to, the store, bring back a diaper, and he's like, no, you need to. I said, no big thing. It's just stressed. Just happened to be the day before, but guess what? They put me into the MRI, and all throughout my body, I guess my health growing up and to this time, it showed that throughout my body and all the broken bones, hey, my hips weren't even attached. The doctor kept asking me, when was the last time you walked? And I was like, yesterday. And he was like, looking at the x-ray, bringing the nurses and the other specialists in, and I'm like, big deal. But my body's been through a lot. And he's like, no, there is no way you walked yesterday, and you're gonna need replacement, knee replacement, hips replacement. And I'm like, for what? I'm not even older. And there's like, no, arthritis, you have ortho, you have rheumatoid.
So what happened? Did you have surgeries?
Everything.
So you have hip replacements?
Yes, ma'am.
And knee replacements?
Absolutely. And the crazy thing about my hips, Hurricane Harvey hit, if you remember 2017, I got stapled back. So this leg I can lift up. I had to learn with physical therapy, but this leg I physically have to do myself because I was stapled and I gained a lot of weight. So being in a wheelchair, having the arthritis, it was foreign to me. And I'm still sitting there going, I have full coverage. I'm now on FMLA, but it wasn't enough. Jessica, when I saw those deductions for each surgery, $10,000 each, I'm looking in my mind going, hey, you have a job, you have insurance.
Right.
It didn't add up.
Yeah.
It's covered, but these deductions and the type of medicine, when you're going to the pharmacy and you're like, oh, $30, I got that. But when they say $1,500, when they're saying, okay, you're off now, each surgery, you're gonna be off for 6 months. It did not cover that insurance where I had the advance and all of these things that now I need to use it, but then I'm going to be off for even more.
Right,
So,
was there a large deductible that was there?
each surgery was $10,000.
They were not even covering, okay.
Oh, it will cover after you pay that $10,000.
Okay.
And while this is happening, bills are coming in.
Yeah.
So that's why I understood where I'm looking at my house going, yeah, full check. You're not getting a full check when you're on all these things. And I'm looking at going, I might be disabled after this. They're like, yeah, you are you going to go back to work? I have to learn how to walk again. I gained another 100.
What age were you at that?
Man, 2017, I'm 48 now, so we had to do the math. So
You were early.
43?
Okay.
Yeah,
And
I'm
so
shocked.
you've did all the surgery and rehabilitated yourself to be able to walk again. And I mean,
Things have to come in play. When you're in the wheelchair, you're eating whatever comes. The physical therapist is coming to your house. I am in shock.
Yeah.
The whole time I'm going through this is disasters are happening, and I'm calling around all of these, the list. And the first thing out of their mouth is, well, kid you not, they're like, because you have a doctorate, because you have education, we can't help you because you have the potential of making money. Well, I'm not making money now. I'm at home. I am sick.
Yeah.
And everybody, I'm researching and I'm going, you can't have this because you're not a 501c3. But I'm like, I helped all these 501c3s, and that's where you see collaborating voices, because my husband was going into shelters and agencies saying my wife is sick but she can't walk. Well, guess what the rule is? Both of you have to be there. You're married.
so Collaborating Voices essentially was founded.
Hatching. Go ahead and use your words.
Yeah, Collaborating Voices hatched when exactly then? After
2019.
Okay, so so it's about 6 years ago. Okay, so tell me, because obviously you look at this and it just kind of explains itself when you look at, the kids, the animals, the wheelchair bound, the older man walking. So tell me about these resources. Like, I know they include from veteran services to disaster relief. Talk about the veteran services for us.
Because my dad was Army, and because of 9/11, he lived in South Carolina, and he was required to drive, and because of 9/11, he would not get on a plane, nor would my grandmother. They would not get on a plane, so they drove to get resources every time he got ill to New York.
Okay.
And that, just watching him, even when he got a stroke, he will have to drive, or somebody drive him to New York to get those. So that's why you see the wheelchair. The wheelchair represents in my logo disability, autism, the person with the cane. We do senior citizens always have things. They're hanging from Collaborating Voices because so many barriers with even shelters. The pets, I take the pets because I have the pets there because that's where mental health comes in. And a lot of people do not put mental health and suicide prevention in that. So a lot of the domestic violence women and the human trafficking, I take them to the shelter because when they see those animals coming out and they're walking and they try to put them back in there, they see the tail go down and they know, hey, rescue me. So I look at my logo as where people did not rescue me.
Right.
And I'm looking at when I'm in the community. Absolutely.
So okay, tell me, so somebody came to you, Collaborating Voices, and was like, I need resources for, I'm homeless. Can you help me? Like, you have those resources. Like, I
have those resources.
A place to home them, or like a housing.
Absolutely. We have traditional houses,
okay,
but at the same time, we're running out. As you know, I spoke to you about, there's so many nonprofits that getting millions, and it's not going to housing. It's we're trying to build a resilience hub, which we're at now. It has the warehouse, the teens, the veterans, everybody can shop for free. I have relationships with so many stores and restaurants, shoes, clothes, but those that are in hotels, people are not realizing that those in hotels, that food truck is not coming by. We need the food truck to come by. I've helped formed over 392 nonprofits, and they all have their own mission. Okay. I do not overbear them. Some of them are do foster care. Some are gathering because they have a mission. And that's why, like I said, your show is showing why is our why. And I want people to discuss, why did you go into this nonprofit? Do not leave it behind. So I know that when we're out in the outreach and I'm working with we gave out 798 colorectal cancer kits at home. I didn't even know that was a thing.
Right.
And I tried to show my husband, hey, this is an easy test.
Yeah.
Well, guess who got the call? Me. So I had to go into I'm like, what more can this body take?
Yeah.
But so many people had stage 4 cancer walking around Houston and did not know. So many people with breast cancer, even though I struggled 3 times, I'm a 3-time survivor of cancer, it wasn't breast cancer, but most people know about breast cancer. I'm giving recliners. I'm giving beds. Same thing, I'm giving beds.
So you found people to donate these?
Absolutely.
And to give them to these individuals, like following their cancer treatment or their whatever they're going through, and be able to have those.
I'm hoping for a voice. I give a voice to even nonprofits that say, I have the outreach of breast cancer. They're not really looking at the fact that somebody needs to be picked up. We need more vehicles. More nonprofits need vehicles. More nonprofits need box trucks. Because it doesn't matter if we know about a nonprofit down the street, you have to walk in, and we need more people to go door to door.
Yeah, to be connected. I mean, Hatching for Health we have a vehicle that provides transportation, and it's been solely based on helping children, but we've also been open if it's available, like we want to be able to transport whomever is in need of that, medical related. But yeah, I know that becoming that resource for some of these hospitals was like shockingly like something that wasn't there. It's either, if their insurance pays for it, great, but if they don't have that and they have a Medicaid, the Medicaid system is kind of oversaturated, and so then there's difficulty getting them to their appointments on time. So I know that
just like you see a tangible resource that is not being addressed.
Yeah.
And that's where we are. I'm about tangible resources. I'm not about getting into a meeting, talk about what we're going to do as nonprofits. I'm looking in the room going, okay, how can you help us build this? Okay, traditional houses, do you want one? I don't need to run it all, but I do understand that I can connect people to the resources.
Yes. Is gardening was something also, like tell me about the gardening aspect of your
being
foundation.
Sick when your body's going through stuff, you absolutely understand that Mother Earth has what it needs, and you don't need 21 medications.
Right.
It might make you sicker. So in all throughout of Houston, Fort Bend, and Montgomery, we have schools that have opened their doors and say, can we teach gardening? We have farmers out there, the bakers that's been in Acres Home for 40 years, and they got greens and everything. So a lot of times, even when restaurants give me food, people are requesting bananas and okra and all these other things. So they didn't have a voice. So I come in and I go, okay, you're out here in the garden, but you don't have a shed. Oh, nobody's gonna give it to me. Here I am. I'm down there at City Hall. I'm calling people going, we need a shed. I'm calling the university saying, we can serve more. When I'm going into the schools, you know that some of the kids cannot take a canned food home, but they quickly can eat a carrot or an apple.
So have you been able to get in some of these schools
Absolutely.
and have
We're
an
in 14.
area where they're doing gardening? And
we're in 14.
Okay. 14. Okay, that's
Absolutely.
great. Yeah.
Yes, ma'am.
No, that's fantastic. And so with like a volunteer aspect, how do people like reach out to be able to volunteer?
Guys, the first thing, make the decision to be impactful and come together as a community. Collaborating Voices in all social media, collaboratingvoices@gmail.com. You can look up even Dr. Kathy L. Tatum for Impact. Inbox me. Let us know how we can work together. If you have a problem and we can even solve it. I think in the last even 6 months, we have given away over $2 million in tangible resources to hand them out. So if you're having an event and you can come pick up, but at the end of the day, we have a lot of people struggling with health, and you have an outreach. We need clothes, we need shoes, and we absolutely, if you want to donate to us with helping us with our Resilience Hub, please reach out. It costs us $10,000 every quarter to even sustain. So please reach out, but right now, I know for a fact on our list, we have over 300 people that can't even get to their doctor.
Okay, wow. Yeah.
And they're frustrated, Jessica, because as you know, handicap spots, if they have a wheelchair, people are parking in them.
Yeah.
They can't get out. And even sometimes when you take an Uber, there's no one to help them get out of the vehicle.
Well, connect with me about that.
Absolutely.
We have a full-time driver now, and if he's not transporting children, then we'd love to transport.
Thank you.
Any people of any age, really. So that's where they can find you. Okay, so I know that we're kind of having to wrap up, but As far as the domestic abuse, because I know that there's foundations and organizations that help with that, like, are you somebody people can go to for even resources on that aspect?
I am that undercover person where when they have this community stakeholders, I'm never in the room, but the law enforcement texts me at 2 o'clock in the morning because there's no clothes. So I love the other organizations. We all are important. Right. But our tangible resources, I'm getting out of my bed because that officer, that person has a bed. Like right now, I have a young lady that has 6 kids. She's in a hotel. She needed diapers. She needs things from the domestic violence. Yeah. And I have nurses. I have medication. I have the resources.
So let you be a resource to these
individuals. Let me be the resources.
Like if you're watching, reach out to Miss Kathy with Collaborating Voices. Through her social media.
Collaborate.
Yeah, collaborate with her so she can be your saving grace. So we will definitely let everyone know where to find you. And while you were mentioning it, it'll be popping up on the screen. But thank you so much for being vulnerable to tell your story. Like, I mean, I'm sure like it's like an onion. You just keep peeling back, and it's so much you've gone through. So bravo to you, and to like using that for strength to help others. So God bless you.
God bless you.
Yeah. And thank you all for tuning in to another episode of Hatching for Health. I hope you learned many things and have found somebody for a resource or share with others the resource that Collaborating Voices can have for your life. Thank you, and we'll see you next Saturday here at 9:30.